Back on your Friday. Remember when we started the new year with those hazy skies really taking over the air? We're now halfway into January. Hard to believe, but air quality is still a big focus.
That's right. A new study is suggesting an increase in wildfires in the West is ruining our air quality. And this is all being linked to an increase in death and health problems. We want to bring in 12 News journalist Jen Wall. She's joining us live this morning to break down this study and also tell us what health experts are really seeing locally. Jen, what's going on? This is pretty alarming.
Yeah, good morning to you. So the uptick that the study is talking about in wildfires and their intensity, well, the study says it has unraveled years of air quality gains. Now, the study is aiming at the West and looking at the West as a whole. So I wanted to see how it impacted us right here in Arizona. The study published last month in Lancet Planetary Health. So it's trying to estimate trends in black carbon fine particle concentrations in our air and how it harms our health, increasing deaths. The Lancet found black carbon concentrations rose 55% on a yearly basis, mostly because of wildfires. And the fires caused an increase of about 670 premature deaths per year in the western U.S. from 2000 to 2020. The study reported no major declines in these numbers in the eastern United States during that same period. Now, on a positive note here, Dr. Christian Jivku, he is a critical care physician with Honor Health here in the Valley, and he says the Valley has not been as affected by the wildfires in California and across the West, and he has not seen a persistent trend. However, there are times of year when it's dustier outside or there's poor air quality, and he does see an increase of some patients coming into his hospital. Dr. Jivku says proving causation between an increase of smoke and deaths is a really intricate task.
I am skeptical when any studies try to prove causation. Yes, these two areas correlate. For instance, if you look at the study, the year 2020, they include that in the study. Well, that was in the middle of COVID, so it's very hard to extrapolate, well, which respiratory deaths are from fires when most of us were indoors and which ones. So it's really hard to prove causation in those cases.
Dr. Jivku adds that precautions taken when wildfires are burning nearby depends on fire intensity and how close you are to that fire. The closer a person is to the blaze, whether they have lung disease or not, they do need to be more careful. The farther away from a fire, people without lung disease can usually continue normal outdoor activities, but Arizonans in those sensitive groups that we always talk about, they need to take the necessary precautions to protect their health, like staying indoors and using air filters. And Dr. Jivku says, this study does not impact how he treats his patients and the advice that he gives them on a daily basis when he's in the hospital. But on a national standpoint for public health, he says that it's really important that they continue to track these kinds of things to watch our air quality as a whole. And speaking of air quality, I talked with the Arizona Department of Environmental Quality, and coming up live in the next hour, you're going to hear from them. They're going to weigh in on how they're seeing things across Arizona with this increase in wildfires in the West. For now, we're live in Gilbert. Jen Wall, 12 News Today.